Always happy to be joined by Dr. Syed Hussain from Trinity Health of New England to talk about what is trending in the world of health. And this morning we want to start by talking about a new survey from the National Center for Health Statistics regarding long COVID. Doctor, good morning. Good to see you again.
Likewise.
So that survey said there's 18 million adults and 1 million children still suffering lingering symptoms from a previous COVID infection. Long COVID has taken a long time for us to start to wrap our heads around. Where are we in that process in terms of defining what is and what is not long COVID and what we can do about it?
Yeah, that's a great question, Tim. So this study in particular showed numbers that are a little lower than what we thought previously. One reason may be because of how the survey was designed and the question that was asked. So the question on this survey, with the statistics you just mentioned, basically asked people who took the survey, have you had symptoms that lingered for more than 3 months?
Yeah.
The CDC definition, though, is more than 4 weeks.
Okay.
So the number is likely an understatement. There are millions more. What we do know is it impacts adults more than children, minorities and women more than others. And it goes back to some of the same issues we've discussed previously, you know, the access to healthcare, disparities that we've seen come up during this pandemic. But on the promising side, we've seen the Health and Human Services award the first of its kind $45 million grants in July. And basically to foster more research and best practices to deal with long COVID, because we know we're going to be dealing with this entity for years to come.
Yeah, and I think one of the central questions we're going to try to get answers to is if you have it for a long time, like say upwards of a year, are you going to have it forever? Is it going to go away at some point? It seems like there's differing answers depending on where you are. Moving on, the Centers for Disease Control and Prevention expecting mothers to take the RSV vaccine. Of course, if you've been to a children's hospital in the winter, you understand it hospitalizes young children, respiratory syncytial virus more than anything else. Where do we stand with that recommendation? What would you think expected mothers who are a little hesitant should do?
Yeah, I can't emphasize how important this vaccine is for your children. The leading cause of hospitalization in this country in infants is RSV. The CDC estimates RSV will impact all children by the age of 2. But the most youngest, the newborns, are most vulnerable, Tim, in terms of complications that can happen and hospitalizations. We've seen what happened last year, for instance. This is the first season we're getting into with RSV, flu, and COVID, where we have vaccines for every condition. And just to remind viewers, RSV vaccines are now available for not only newborns through their mother. So weeks 32 to 36 is when the CDC recommends a pregnant woman should get the vaccine. And if you're above the age of 60, then it's also recommended, because those two age groups are the most vulnerable from complications from RSV.
Yeah, and it's so prevalent, like you said, everyone's going to be exposed to it at some point, usually by age 2. So it's just a question of how your body responds to it and what you can do to fight off any problems. All right, lastly, let's talk about dementia. Actor Bruce Willis's wife said she's not entirely certain whether he's aware that he has frontotemporal lobal dementia, which is granted on the rarer side of dementias, but it does bring up a larger question. To what degree do we know that patients with Alzheimer's, Lewy body dementia are aware of their condition and how it's limiting them?
Yeah, that's a great question. There is a progressive neurocognitive impairment, as you know, Tim, with these conditions. With dementia in general, Alzheimer's is the leading cause, but there are many more types that go into this umbrella dementia bucket. And it takes a toll, not only on the patient, but more importantly, on the loved ones taking care of the patient. So the awareness needs to be there, and what kind of care we can deliver to these patients. On the good news, though, on the good front, is that we have seen a decline in dementia diagnosis from 2000 to 2016. So that's promising. But it's still an entity that needs more awareness.
Yeah, and just given that there's more Americans and we generally tend to be living longer, it's probably going to be a growing problem, not a shrinking one. But unless we can find more things to do about it, that would be good. Doctor, thank you so much for joining us.
Thank you, Tim.
Dr. Syed Hussain from Trinity Health of New England is always blessing us with his knowledge, guys. Let's send it over to you in the studio.